like to talk with you one more time about the two most devastating things that can happen to a total joint. That's falls and infection. So we talked a lot about falls, how your pet can help you fall and the things that you can do to ensure that that doesn't happen. But let's talk about infections. So you'll notice throughout our hospital we have many foaming stations. In fact, there's one inside your room and one directly outside your room. When someone's walking into your room, a medical professional, it could be your surgeon, it could be myself, it could be your nurse or your therapist, they should be actively wiping in the foam sanitizer. If they're not doing this, I give you the permission to send them right outside the room to tell them to foam their hands. This is very important. You have to also make sure that your visitors are doing the same. If you feel like your visitors aren't feeling well, perhaps they've got a little cold or maybe allergies, you just need to let your nurse know or let me know, and I will very, very politely suggest that they call you on the phone instead. That's how important it is for us to make sure that you don't get a post-operative infection. When you go home, you also need to make sure that hand sanitation is still happening, whether it be by directly using soap and water or getting hand sanitizer. You can go to the supermarket or wherever you do your shopping and buy any brand of hand sanitizer. I suggest that you get 2 of them throughout your house. Anytime you're shaking someone's hand or touching an object, you need to make sure that you're sanitizing your hands after you do that. Also, when your visitors come to visit you after surgery at your home, they should be sanitizing their hands. And don't forget your grandkids, they also need to sanitize as well. Everyone's going to be going home with some sort of dressing on their incision. This dressing is only to be changed or removed by one of 2 people. That's your physician or your home health nurse. It's not show and tell. You can't go home and remove your bandage and show all your friends so that they know how big your incision is. That dressing needs to remain on so it protects your incision. Remember, the incision is not closed for at least 3 months after surgery, so you really need to protect that. Remember, we don't want you to get a post-operative infection. Along with that, no submersion. However, showers are okay. We encourage you to keep your body clean. A few more reminders for you. Everyone is going to be going home on pain medicine. One of the side effects of pain medicine, something that everyone is going to be going home on, is constipation. One way to prevent constipation is you can have increased water intake. In fact, for every glass of tea or cup of coffee or carbonated beverage that you have, you should have 1 8-ounce glass of water. You can also take an over-the-counter oral laxative. You can get this at any of your favorite drugstores. You do not need a prescription for this. And just some general reminders and points of emphasis. We are a smoke-free facility. We don't allow cigarettes, e-cigarettes, chewing tobacco, pipes, or cigars on our facility. In fact, we don't allow them anywhere on our grounds, so please let your family and friends know. That also goes for you. If you currently are using tobacco products and your surgeon does not know about that, or if you're hiding that from your surgeon, there is a very high chance that your surgery will be canceled. In conclusion, we hope that you found our video series educational. We encourage you to view it in its entirety. In fact, you can go back and review parts of interest for you. We also highly encourage that you share this with your coach and with your family members. Again, thank you for joining us, and we look forward to seeing you.